Welcome to Live United. My name is Karen Knapp, President, CEO, United Way of St. Lucie County. United Way focus is in the area of health, education, and income. And today we're going to be speaking with representatives from two of the agencies United Way funds throughout the year. And we want to welcome Christine and Dr. Passeri. Welcome.
Thank you.
Thank you.
We're so happy to have Hands Clinic, of course, but Volunteers in Medicine now you're well known for. The clinic started a few years back, and there was a reason for that. Let's talk how important it was to our community to really start this clinic and keep it running.
Well, I think the need was demonstrated several years ago, as you say, back around 2008 and 9, when a group of concerned folks in St. Lucie County got together because the number of people without health care access was growing. And at that time, it was around 45,000. It's now, unfortunately, it's 70. But they became concerned because they realized that the only place that these folks were getting any kind of care was in the emergency room. And obviously, that's a very expensive place to deliver non-emergent care. And it also belied the underlying problem in that people would delay seeking care until they were really hurt and couldn't, take the pain or whatever. And it was sad because many of these processes, these diseases, if caught early enough, could be well managed in a doctor's office without the need for an emergency room visit or expensive follow-up care. So they recognized it, and in 2010, they formed what is now called the VIM Hands Clinic. It's a volunteer in medicine member. We are a member of Volunteers in Medicine. And HANDS stands for Health Access Network Delivery System. It's a long mouthful, but we are a volunteer in medicine clinic.
You did say that, when a person is ill and they put off seeking help, that it could shorten their life, right? And especially people with diabetes.
Yeah, diabetes and hypertension are two of the most common chronic diseases that we see in the clinic. And yes, left unattended, either one of them can be fatal, along with unattended dental disease in an adult. That's another program that we run, because we know that unattended dental disease leads to cardiac disease as well as some other conditions. So yeah, it can become very serious when it doesn't need to be.
Let's talk about the people you serve.
Well, we serve the adult residents of St. Lucie County. If you're between the ages of 18 and 64, and you are a resident of the county, your income level is no more than 200% of the poverty level, which for an individual is around $25,000 a year. You probably are eligible for care, assuming you have no insurance.
Right.
We only take people that are bare, that is no insurance at all. And as I said before, the latest data we have, which comes out of the University of Wisconsin, by the way, they do a county-by-county study throughout the country. They pegged 2015, 2016 at 72,000 uninsured folks in this county. So those are the people we care for.
And many of those individuals are working folks, right? I mean, these aren't just those on Medicaid. These are working folks that possibly their employer does not provide insurance, and that happens a lot. I mean, many of the people we depend on in the area of service, they don't receive insurance from their employer.
Right.
So what do? And many of them can't afford to purchase insurance. So you're here to help fill that gap. I think that's wonderful.
Yep.
Thank you. Yes, that's precisely correct. It's many people. 80% of our patients are working, and again, there are jobs that do not provide, or they can't provide health care insurance. Yeah.
So let's talk about the specific services you provide in case there's someone out there watching and they're in need, which could possibly be.
Okay, well, primarily we provide primary medical care. That would be the kind of medical care you would get in a private doctor's office, family medicine. We provide basic dental care, and we have a mental health intervention with a clinical psychologist. Those services are provided in the clinic. We also have referrals to some subspecialists, some of whom come to the clinic to provide that care, and some who do not, in which case we would refer our patient to their office. We have ophthalmology. Dr. Olstein, who's an ophthalmologist, comes to the clinic, whereas we have other physicians and other specialties where we would send them to their private office. So we try to provide subspecialty care if we have volunteers in those fields, and we're able to refer them there for follow-up care, and if needed, hospitalizations with the cooperation of the 3 hospitals in our county.
So what are the requirements of a person coming in for assistance? What would they need to bring with them?
They would need to bring a proof of income, either last year's tax return or a letter from the Internal Revenue Service saying that they didn't file taxes, a proof of residency in the county, their Social Security card, and if they have those documents, and they're pretty much, that's it, what they would need. Once they bring those documents in and they provide them to the navigator, that navigator will then make an appointment then and there for their initial appointment. And I also like to stress that if you don't have health insurance, but you don't have an immediate problem, you still can come in with those documents and become like a member of the clinic.
Right.
So that when you do need us, you just walk in and make an appointment.
Right.
What days are you open?
We're currently open 4 days a week, Monday to Thursday. However, because of our funding limitation, beginning in January, we'll only be there Tuesday, Wednesday, and Thursday from 8:30 on Tuesdays and Thursdays till 5, and on Wednesdays until 7 o'clock.
And that's medical and dental?
The dental program are by appointment, and generally we settle those cases on Friday, because those are the days that the dentists have off from their office. And so we have a special day for dental patients. They come in on Fridays for care.
Well, you mentioning funds and certain needs. Let's talk a little bit about that. You have fundraisers coming up, and you have needs. So let's talk about that.
Yeah.
We have a lot of fundraisers coming up, and actually all the information that Dr. Passeri just gave out, you can go to www.handsofslc.org. That's where all the information is there. But as far as the fundraisers are concerned, our next one would be in January. We have a boot, scoot, and boogie that is put on by one of our local residents. Her name is Janie Reed. I don't know if you're familiar with the Lady of Julia project that we have, but if anybody's interested in that, they can go to ladyofjulia.org. But she is putting that fundraiser on. It's called Boot, Scoot, and Boogie at the Tin Roof, January 27th. The tickets are on sale now at ladyofjulia.org. And there you can see the rest of all of our events that we're doing as well. Fundraisers for the clinic, we are going to do another open house. We did an open house in it was November. We were supposed to have it in September, but because of the hurricane we had to push it back. But that was great, inviting people into the clinic so they can come and take a look at what they're going to. Sometimes I think, when you make an appointment at a doctor's office and you don't know who they are, you've never met them or anything like that, to come in to see the facility and take a look at everything, you're a little bit less nervous. So we are going to be doing another open house probably in February or March. But our needs, we need some dentists. Am I right, Dr. Passeri?
Yes, dentists, yes, for sure. Yeah, we do.
We need some dentists.
Yeah. Well, I think it's important at this point to also mention that currently the 3 stable sources of funding that we have are as follows. We receive a grant from the Florida Association of Free and Charitable Clinics, and we're one of 109 clinics in Florida that are part of this program. So we apply each year for a grant, and we've been very fortunate in getting a grant from them. So they're a major funder. The county commissioners have been very generous to us over the past few years, and they've also funded us. And here is where the United Way jumps in. United Way is a major supporter of the clinic, and because of the United Way's generosity, we've been able not only to fund programs in the clinic through the actual core grant, but we're also able to fund a pediatric dental program, both for screening and for sealants. So that's a major program. We don't have any other pediatric program at the clinic. As I say, we're for adults. However, this initiative for children has been in effect for the last 5 years, 6 years, And with our dental hygienist, Irvin Valson, who goes to the schools and screens children, he screens around 7,000 to 8,000 a year. He's seen some of them in the first grade, and he's also seen them again in the fourth grade and the sixth grade, where in one of the times they might get a sealant application. But what's more important is when he initially sees them, many times the dental disease involvement could be probably 70% of their mouth. When he sees them again 2 or 3 years later, because they've taught them good hygiene, that the incidence of dental disease drops dramatically. They might only have 5% involvement or no involvement. So this is a case where preventative medicine really pays off. It's the cheapest way to do it. It's the most beneficial way to do it. And has been able to keep these children's mouths healthy. So it's a major program, even though it's not physically located in the clinic, but rather in the community. Its impact is gigantic in the community. So we have the United Way to thank for both of those programs. And you become very, very integral to our survival.
Well, we're very proud, and we're very proud of all that you accomplish in your clinic. But thank you very much.
Well, it's true. It's true.
Stress that. It was very nice. Was not planned, right?
No,
Okay.
But it's the truth. You have to say the truth.
Let's talk about the dentists. I know that you have a very big need, a great need for more dentists to volunteer. And the dentists you have now, they volunteer maybe 1 day a month?
Yes, they give us at least 1 day a month, sometimes 2 days a month or 2 Fridays a month, depending on their schedule. And they're doing their part. I congratulate them. They've been very good to us. But the need is so overwhelming that the number of hours that they give us can't satisfy the need that's out there. And the need is an acute one in the sense that folks with these dental disease problems, some of them can't get a job because they can't smile or they can't open their mouth. Some of them are in continual chronic pain. There's all sorts of issues going on with them. Unfortunately, some of them have concomitant medical diseases that when the dentist examines them, we find oral cancers, in which case this is a whole other set of problems that we need to refer. And so it's very important that we're able to interest more dentists perhaps in giving us some more time. Would be very, very helpful to the community.
And I'm pretty sure that we would accommodate their schedule. If they couldn't come in on a Friday, if they could only come in Tuesday for a couple of hours, we would do whatever they needed to accommodate their schedule.
We only do the Friday scheduling because that's when the current dentists are available. But those chairs are lying vacant the rest of the week, and our dental coordinator is there. I mean, she's doing other tasks for us because she's there, but oh my goodness, those 4 chairs, we'd love to occupy them 5 days a week. Yeah.
Absolutely.
And you're also looking for volunteers?
Yes. Yep.
Yeah, well, you would speak to that.
Go ahead.
We're always looking for volunteers. We're looking for volunteer physicians, of course, to help with our professional staff. And I'm very grateful to the volunteer physicians we have who come to the clinic. Dr. Roberts, our medical director, Dr. Sands, who's a practicing physician, Dr. Kinney, who's a retired ER doc, who gives us a lot of time, Dr. Haight, who comes in from Wisconsin to help us, Dr. Lau, who's a GYN doctor who comes in, Dr. Zolikoff comes in, and so many others. And then again, there's a whole group who we refer out to their offices. But we certainly would love to accommodate more physicians. We have the exam rooms, and we have the patients. And non-physician volunteers, most certainly we can use them. There's a whole bunch of clerical activities that go on in that clinic, of data collecting, as is in any medical setting. And that would be very helpful to us.
Right, and we don't want to forget Martin Health Systems and Lawnwood, HCA Hospitals.
No.
They give a lot in kind services, and we can't say enough about what they do as well. The county, you have so many wonderful partners between the county, the medical field, and of course some of the retired doctors. Some of them are still working right now, so that's just wonderful. We want to thank you for being here with us. It's been wonderful. I know it's been such a short time, but you do so much, and there's so much we could talk about.
Absolutely.
But do thank you for being with us, and we'll be right back.
Take my hand and start a brand new day, and together as one we'll start to see some change.
Underneath everything we are, underneath everything we do, We are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Hi, welcome back. Our guests now are from Alzheimer's Community Care. Welcome, ladies.
Thank you for being
We're
here.
here to talk about what Alzheimer's Community Care does and a little bit about, Alzheimer's disease and dementia. First, let's talk about the agency itself. You're here in St. Lucie County.
Yes.
Let's talk about your facility here and your services.
We actually have 2 specialized adult day centers in St. Lucie County, in Fort Pierce and in Port St. Lucie. And the specialized adult day centers are specifically for patients that have been diagnosed with Alzheimer's or a related neurocognitive disorder. And with no effective treatments, really the only effective treatment is the day center, where we challenge them physically and cognitively, basically all day long. And the goal there is to actually slow the decline of the disease and to keep them socially engaged and active.
And it's not just about the patient, it's also about the caregiver. I know when we were
Absolutely.
there visiting, considering funding, you had someone there who talked about, a caregiver, who talked about, their life and how your services really helped ease the stress and the worry that they have every single day in their lives. So let's talk about the caregiver and how important it is to those who are caring for these people with Alzheimer's and dementia.
It's critical to take care of the caregiver, and that's what's so unique about our model. Because while we offer that respite and that physical and cognitive challenge for the patient, our family nurse consultants are working with the caregiver, and we're offering support and resources and linking them to whatever additional services they need to take care of themselves. They have to take care of themselves in order to be caring for that patient.
And people who are recently diagnosed or a family member suspects that there is a concern in that area, they could call you, they could call your family nurse and set up an appointment and to find out more.
Absolutely, and one of the wonderful things is that that service is provided at no cost to the family.
Right.
These are grant-funded services.
Yeah,
so,
that's what United Way funds.
yeah,
That's
and
good.
the family member is investing their time and can learn a tremendous amount, and we can help them navigate. And to your point, many times they have not had a specific diagnosis. They're calling us well into the process and really need a lot of resources and services.
And there is a difference between normal dementia as a person gets older and Alzheimer's disease. Let's talk a little bit about the differences.
Well, there really is no normal dementia. Symptoms of dementia are not part of normal aging. So as soon as someone is thinking mom's getting a little forgetful or they see a change from their normal baseline, that is the time we hope that they go and get that evaluated. Symptoms of dementia, which include, of course, the memory loss that we're all familiar with, and a failure of what we call executive functions, driving, paying the bills, taking care of the household. When you have those 2 dynamics, it's critically important. Those are symptoms of dementia. Critically important to find out the root cause. They can be treatable causes. Things like hypothyroidism, depression, certain vitamin deficiencies. These are treatable. And so it's always important to seize that opportunity to treat what's treatable. If there are no treatable conditions, we navigate that family to a neurologist that specializes in neurocognitive disease, so we can identify the most likely and then arrange for the most appropriate interventions at the earliest moment.
And you think about our population here in St. Lucie County, and we are growing older, and so we have many people who are of a certain age, but Alzheimer's, I know, the disease can strike earlier, like 40s. To me, that's early.
Very
So when we look at the numbers, do you see them growing?
They may grow as a matter of better identification,
Okay.
But the estimate is 1 in 10 over 65,
Okay.
1 in 3 over 85. And so if you look at the current census for St. Lucie County, very conservatively, you're over 7,000 people potentially. Understanding that most are diagnosed middle stage, the unknown number are those in early stage. And the problem with that is early stage is really the only time we have a better chance of getting some substantive interventions. And that time is often missed.
That's why it's so important. And it's so important to make sure we have the funds to help those individuals. And so let's talk about your upcoming fundraisers.
Okay, I'm excited to talk about it. On January the 18th, we have our premier annual fundraising event for Martin and St. Lucie County exclusively, and that's our luncheon. It's called The Beauty of Winter. For the next 4 years, we'll have the Alzheimer's Community Care Seasons of Life luncheons, where we celebrate each season of life and discover the beauty that can be found in each season, no matter what. But it is our premier fundraising event that allows us to provide the services that we provide. All the money raised here stays here. So as our CEO, Mary Barnes, likes to say, your money goes far, but not far away. And so if it's raised in Martin and St. Lucie County, it will stay in Martin and St. Lucie County. And this will be at the Harbor Ridge Yacht and Country Club. At 11 o'clock, our silent auction will start. At 12 o'clock, our luncheon will start. We'll have some speakers, a little entertainment. It'll be a nice, beautiful day, and those who attend will be really going forward, helping us fulfill our mission and going forward with our mission. You can go to our website, which is www.allscare.org, and you can register for the luncheon, or you can call our office and I can register you.
Are you looking for volunteers, or do you need silent auction items?
So there's lots of opportunities for things like that. We always need silent auction items. We need business partners, businesses who are able to provide a sponsorship. There are varying levels from $250 to $5,000 or whatever a company can do. Silent auction items are always needed so that we can have a beautiful silent auction and raise money that way. And volunteers are needed in two ways. We always need ambassadors, people who can their neighbor is diagnosed with Alzheimer's and they say, let me tell you who to call, because we don't want someone who needs help to go without help. And if it's just a matter of them not knowing, so we need voices in the community. And then you can volunteer if you want to call my office. I have lots of volunteer opportunities preparing for luncheons, which is office work. Then we have a Care Buddy program. We have lots of different opportunities that work directly with our patients, that work in offices. There's lots to be done and there's lots to do because we do provide services for patients and the caregivers as well.
Traveling 95, which I just did a few days ago, I saw the alerts. And I don't know if everyone understands what that means and how to react to it. You want to talk a little bit
we're
about
very proud to have led the team that came up with the original Silver Alert process, which was for those lost driving a vehicle. The original law signed in 2011 did anticipate that people could become lost driving or on foot, but the infrastructure was really only in place for those driving. So those message boards alert the surrounding area of someone that is in a vehicle and believed to be lost. 2 years ago, we were asked to head up a task force to come up with a lost on foot process. And we have several hundred episodes a year in Florida of people either leaving their home, their private home, and becoming lost on foot, or leaving their assisted living facility or skilled facility. And if they're not found quickly, it's often, unfortunately, a tragic outcome. So we have the Lost on Foot Silver Alert process, which weighs heavily on the use of the ID locator bracelet. And we have several dozen, I believe, ID locator bracelets in place in St. Lucie County for patients. So if they should leave the home, the caregivers are urged to call 911 immediately, and they can be located very quickly through the use of a specific antenna. And that timing is critically important in order to locate that person and find them safe and sound.
Sounds like you have a strong partnership with law enforcement.
We do, and we're on their regular training schedule. So we take part in the St. Lucie Sheriff's Office crisis intervention training. And we present just this training. How might you know if someone has a neurocognitive disorder versus a mental illness, there are different approaches with those different dynamics. And the Lost on Foot Silver Alert and the bracelet program is a huge asset. I always have a law enforcement officer tell me a successful story because of the use of the bracelet and finding someone quickly.
And that is a completely free program. People can call and say, you know, my husband, my loved one needs this, and they'll meet with our family nurse, and there's no cost at all to the family.
Oh, well, that's a good piece of information
It
to
is.
put out there.
It is.
Let's talk about your specialized daycare services. When someone is placed in a daycare, your daycare, what's the day like?
The day is packed. It's packed with activities that are, as we said earlier, cognitive challenges and physical challenges, and that's actually defined in the law. There is a particular law that governs specialized adult day centers. Activities must be therapeutic, and that means they must engage that patient and actually tap into those skills. So there is no limit to what they may engage in. Word games, math competitions, current events, trivia, actual physical games. We have live music and dancing. They are, patients are amazing artists, and they create centerpieces for their events and for some of our organization-wide events.
Nice.
We give them a theme and they create. And they're just honestly busy virtually every minute if they're not eating a meal. They're breakfast or lunch, they are busy.
What about insurance? Many people, you know, they wonder, does my insurance cover this? Because, you know, it costs, you know. I don't know, maybe you could talk a little bit about that.
Want me to cover? Many patients actually can access benefits for specialized daycare.
Okay.
A veteran of active service, and it can be 1 day in active service, is generally eligible for VA benefits for the day center, which includes meals and transportation. The managed Medicaid plans, and we are providers for all of them, see the benefit of specialized daycare, and they support our programs. Others may also be eligible for specific grants and scholarships. And lastly, additional funding can also be through specific long-term care policies. Some people actually have purchased long-term care coverage that does include day center. So we have social workers, our case manager, that will meet with the family. That's also a service provided as a courtesy to help match them with available funding.
Well, we have about a minute left. Is there anything you want to quickly cover? Did we hit on everything?
Well, we could go a little bit further into the year. On May 17th, 2018, we will have our educational conference. And the last, pretty fair number of years, it has been held down in Palm Beach County at the Convention Center, which is a little bit tricky to get to. And we have moved it to PGA Boulevard. So we've moved it closer, and in hopes that more from St. Lucie County and Martin County will be able to attend. And that will be May 17th at PGA National.
Well, that's just
right.
wonderful. You know, you've given our audience so much information, and you do such a fine job. You're really filling the gaps in services when you think about all the people that are in need and will be in need in the future. So our viewing audience can call you if they have any questions.
Absolutely.
And we thank you for being here with us.
Thank
and
you.
we want to thank you for joining us. And if you want to hear anything more, you can call United Way office at 464-5300. Thank you.